It's feared that the HIV prevalence in Uganda is on the rise again. It has reached a level where the number of new HIV infections are matching the number of AIDS-related deaths in the country.
There are many theories as to why this may be happening, including the shift from the abstinence prevention-based program. It is also suggested that the presence of ARVs has changed the perception of HIV from a death sentence to a more treatable and manageable disease. This has reduced the fear surrounding HIV and has also increased the risky behavior, especially among the youth.
U-report is a free SMS-based system that allows you as a young Ugandan to speak out on what's happening in your community and work together with other community leaders for a positive change. For example, this week we are talking about HIV and AIDS. But first, Rachel, how does someone become a U-reporter?
It is very easy to be part of U-report. Simply text the word join to 8500. All the messages you send to the number 8500 are totally free of charge across all networks.
Step number 2, you will receive a greeting message and a series of questions like who you are, where you come from. We at U-report would like to know more about you for a better interaction.
Step 3, after you have answered all those questions about you, that's it. You are proudly a U-reporter.
Step number 4, as a U-reporter, you will receive weekly poll results and meaningful information that will help you enact change in your community. Last year, on the 30th of November, the day before the World AIDS Day, we sent out 42,000 U-reporters with the following message. Hi U-reporters, go to your nearest health center and find out if they give free HIV and AIDS test. 72% of all the respondents said yes, while 20% say no, they don't give free HIV and AIDS test.
Those who did find free HIV and AIDS tests in their local health centers also shared with us some good strategies that they use to keep their youth safe and healthy. For example, a U-reporter told us at Naguru Teenage Health Center, we are given free treatment, guidance and counseling services, free condoms and antenatal care. Another U-reporter told us that the strategy by the AIDS Information Center of introducing late evening and night HIV/AIDS testing, called moonlight testing, attracts dozens of people, including students. Thank you very much, our U-reporters.
Here is what other U-reporters from other parts of the country had to say about availability of free HIV and AIDS testing at the health centers nearest to them.
Some facilities charge when it comes to testing, and most especially the private facilities. For you to get an HIV test, you must pay 5,000. I know most of the youth in Mbale are unemployed and they would wish to know their status. And by the time you are going for a test and they ask you to pay 5,000 shillings and you don't have, to them it becomes a challenge.
I've not so far tested for HIV because the testing centers, they are not nearby our residence, and another one is that I also fear that tension of finding out myself in danger.
The challenges the youths face in Tororo here in accessing where to test for HIV and AIDS includes 1, lack of funds, 2, some are ignorant, 3, lack of counseling and guidance.
I have ever carried out HIV test nearly 10 times now, but the first time I went for that, I really had a lot of fear with me. I'm like, now how can they see me going for an HIV test? Even I had a feeling that the ladies whom maybe I'll be approaching, when they see me going for HIV services, they may get scared and they're like, I think Robert is now gone, so we don't need to get in touch with him.
Some youths, it's hard for them to go for HIV testing because they start engaging in sex at early age, unprotected sex at early age. So they fear to go for testing, thinking that maybe they're already positive.
To my side, I didn't face any difficulty or any challenge because I was interested and I was eager. And when I went there to test, I patiently waited for my results. I was counseled, and all went on well.
Unlike in the past, where one would necessarily need to visit a health center or camp for HIV and AIDS testing and counseling, today the service is brought to those who need it.
A mobile van for free HIV and AIDS counseling and testing was recently launched in the 5 divisions of Kampala. This van has a fully equipped laboratory, 2 counseling rooms and a reception. This and more after the break.
If I'm to ask the government to change the education system,
for someone to go into marriage,
someone
will never have
the government can come in and say now.
Have your say. Text the word join to 8500 for free. U-report, because your voice matters.
Hello and welcome back. U-report is a weekly TV show that allows you as a young Ugandan to speak out on what's happening in your communities. It's very easy to become a U-reporter and let your voice be heard. Simply text the word join to 8500. All text messages are free of charge across all networks.
This week, we would like to find out if there are free HIV and AIDS counseling services in your community. We would also like to know if there are innovations that are bringing the services closer to you. But first, let's find out from our U-reporters in the field.
I've never tested for HIV because I fear the results. I think I might die from then. Yes, that's why I never tested for it.
The process is always easier for me. So go there, tell them I've come for this, why I want to know my status, then what if you discover that you are HIV positive, what are you going to do? I tell them I'm ready to live positively with it. And basically that is the reason I wanted to come here to find out how I stand.
Every like 2 months or 3 months I do test for HIV because I want to know my status, ever, always and ever. And I want to give others also to know that I'm still okay, like my partner, to trust me and also to trust my partner.
I've ever carried out an HIV test, but before I had a test, I was having some challenges, like I was having fear to test whether maybe I can be positive or because, but after testing, then I became sure of myself.
After getting tested, they give you the specific. Now, let's say when the CD4 count has reached the recommended, that they know, they give you the exact dose, the exact drugs for the AIDS, other than other dose, because the more you'll be going pretending that maybe it's of malaria and you need to get tested, you fear to be tested, they can give you other tablets which can be that can cause repercussions on you. So I advise people, my fellow youth, to go and get tested.
Many people shy away from visiting health centers for HIV testing and counseling, and this leaves very many at risk of contracting HIV and AIDS. The highest prevalency rate in Uganda is in urban areas, and in particular, central Uganda. New innovations such as the mobile HIV testing and counseling van have been brought closer to the youth in their own locations, instead of them taking a trip to health centers. Now this makes it easier, faster and more convenient for the youth to access health services, and also raising awareness on HIV and AIDS.
I'm inside the van. It's a simple corridor to the counseling rooms. So that's where I'll get counseled on what to expect, how to react. After that, I get tested and then get my results. As fast and simple. Doctor privilege. I've just come out of the counseling room, the first session, and it wasn't as bad as you were expecting. So now I'm ready. I know what to do if it goes either way. So now I'm heading to the testing bit where we're going to find out what happens next. How long does it take to get to this? 15 minutes.
today is Daudi Ocheng to tell us more about the mobile testing and counseling van, the first of its kind in Uganda.
We're making sure that the entire Kampala can get tested. Our target is to make sure we can test at least 3 million people by the end of 3 years. Last year we tested about 300,000. Next year we're looking at about 800,000. And right now this intersection is so strategic because you have people coming in from the park and then you have people who are going into the park. So it's a great point where they intersect and we can get a great number of people tested. And we move through all the 5 divisions throughout the whole year. So it's not only here, we're trying to map out the whole of Kampala. The most unique thing about the van is that it moves the clinic to the people. You see, we have a lot of people making up excuses why they can't get tested. Oh, the clinic is far, I don't have transport, I don't have this, it's not confidential. So we've tried to make it as simple as possible. The first thing is, if you're too busy, we bring the services to you. So that is no longer an excuse not to get tested. Once you know where you stand, you have more time to plan for your future. If you're negative, you then stay negative. If you're positive, we now know it's no longer a death sentence. You get onto medication early enough so that you can live the full stretch of your life. It has been proven that if you get onto medication early enough, you won't die from AIDS-related diseases. So that's why we are encouraging everyone to get tested early.
Back in the van, that was a little scary, but totally worth it. It's important for you to always get tested. We asked our U-reporters, especially those who have services close to them, if they had tested for HIV and AIDS and why.
Out of 44,000 U-reporters that responded, 57% said yes and 40% said no. This means that almost all of us do not know our HIV status.
For those of you that got back to us, here are some of your responses. One U-reporter said, "My last test was yesterday with my girlfriend. She now has a lot of trust in me and we are happy that we are negative. So I encourage every one of you to go for a test." Another U-reporter said, "I have gone for a HIV test, but reaching there was not easy. Only courage and confidence can work to save your life and those of other people. And it's only by knowing your status."
Thank you, our U-reporters, for your feedback. After the break, we hear from a doctor who has lived positively with HIV and AIDS for 25 years. Don't go away.
Dear youth out there, let us build and strengthen our country for a better tomorrow. And I urge all of you to join your report. Your voice matters. Thank you.
Hello, U-reporters, and welcome back. As you know by now, the aim of U-report is to allow young Ugandans like ourselves to share our concerns on issues that affect us all. That is why we share your feedback with key stakeholders that can effect change. Today on the show, we are joined by Honorable Anne, a Member of Parliament from Moyo District.
U-reporters, we are very happy to be part of the U-report. We hear you, we read you, and we are also happy that you take some of the advices we give you. For example, there was a question that was asked, what can be done to help people living with HIV/AIDS in the West Nile region? And there are some two U-reporters who have responded. Like one from Arua district said, stigmatization of AIDS victims should be criminalized by the parliament so that the victims show up and they be helped. There was also another U-reporter from Ajumani district who told us good diet, and they should get to take their ARVs appropriately as directed by doctors. They should carry out massive guidance and counseling per village and testing as well. There was also one who said that the clergymen should be involved in carrying out sensitization against HIV/AIDS. These are very positive responses, and this will show to you that we do read your messages, we do appreciate your participation, and we shall be very happy to receive more questions for guidance from you, we shall always try to respond. My advice to the U-reporters or to the youths outside there is HIV/AIDS is a disease that can be prevented, and it cannot be prevented by only one person, not only by government or legislators. It requires a concerted effort. Therefore, as youths, you should avoid peer pressure that leads you into contracting HIV/AIDS. So come out of that stigmatization if you are already affected, and if you are not, please work very hard to ensure that you don't contract HIV/AIDS, because we need you. The future of Uganda lies in the youth of this country.
Today we are privileged to be joined by Dr. Stephen Watiti, a senior medical doctor that has been very instrumental in caring for people living with HIV and AIDS. He's also used his experience to touch many people who are infected and affected by HIV and AIDS. So doctor, please tell us more about yourself.
Well, my name is Stephen. I'm Dr. Stephen Watiti. I like to look at myself as an expert patient. I have lived with HIV for over 25 years, but I'm also a doctor for almost the same period. So that is my dual inheritance, if you want.
How have you managed to live a positive life for 25 years?
I think it's living normal, really. I try to live a day at a go. And I go for medical checkups, and every 6 months I check my blood for effects of the drugs on my body and how the body is responding. And so somehow I know I'm not doing so badly at my age. I've been talking to a young lady who is 24, and she's fearing she may not live long enough to see her child who is 2 years grow. She may never get married. But I'm telling her, no, don't look at yourself as damaged goods. You are okay. I have a mirror in my room. I tell people to look at it. Do you see? What do you see? I look at myself as a normal person with limitations, all right? But limitations come with different. For example, now I know at 60 I cannot win an Olympic medal in running, but that is okay. There are many other things I can do. I know I have HIV, I know what it can do, and I know the solutions to it. So within that limit, and I keep finding out more information, and it's a lot.
So what have you done in your capacity as Dr. Stephen to help people living with HIV and AIDS?
Education is one of them. So I write. Some of the questions asked me by my own daughter, and then many of them were asked me by my patients. Every month I publish articles on HIV. If you read in the health column, with the help of New Vision, we publish some ideas about HIV. And then I also published a book, 100 Common Asked Questions. I published in 2008. Unfortunately, it has gone out of print because it was sold out, but I'm working on the second edition. Maybe by the end of the year I should have a new edition. But also because some of the information there has changed, treatment, and a lot of knowledge has come in, so I'm trying to incorporate by the questions that are commonly asked. I go to organizations talking about how we can prevent new infections, telling people who are already infected that it is not in our interest to have new infection, because then that means the care we are receiving will be crowded out. We would like to be looked after well so that we don't die of AIDS.
What is your special message to the young people?
To the youth, I would say this. There are those who may have got infected from their mothers when they were young. Now, if you've lost your parents or you suspect you might have HIV, it's good to go to a center and get tested. But there are some, for example, who may be sexually active or maybe have had challenges in life. Some children have been defiled and so on and so forth. It's important to check. And when you have checked and you are positive, please do not lose hope and think this is the end. Seek the counsel and advice of a good doctor and a counselor, and believe you me, if you follow the instructions, you will have chances of living a long and normal life, so long as you have good care, like I do.
Mildmay Uganda is the largest provider of HIV and AIDS treatment and care in central Uganda. They do training, research, and provide care and treatment to over 45,000 people every year. Let's hear from Dr. Yvonne Karamaji.
Mildme said in 1998, it was a partnership between the government of Uganda and the British government. Remember, in the early 90s, many Ugandans used to go abroad to get HIV services. But now, with Mildme and other centers like it coming up, many Ugandans access care here. So we want to make sure that we are able to not only give this care here, but also work with hospitals, clinics, all around central Uganda to see that they can also give the kind of service we give here in their different facilities.
Mildme partnered with UNICEF under the U-report project so that we can help with the area of HIV and AIDS. We know that now our population is increasing with the young people that are affected with HIV and AIDS. So all the questions that are related to HIV, AIDS, ARVs, adherence, disclosure, it all comes to Mildme and we're able to answer them. So many youth that have interacted with fear to test for HIV because they believe once they test, they'll be told they're positive. But even when you test and you're positive, you can still come and start on treatment. The earlier, the better. You don't have to wait to drop dead or get very sick and bedridden, then you come for care. There is a lot of care. There are youth-friendly services right here at Mildme, Uganda. And we encourage as many as are willing, as many as can, access care here or in the health facilities that we work with to come and get help, to come and get support, to come and learn something new, because maybe the things you knew in 2010 are not the things today. The way you used to live is not the way now. The challenges are different. So it's a good place for someone to be in, for a positive young person to be with and learn from there.
Quality Chemical Industries Limited is a state-of-the-art pharmaceutical manufacturing plant located here in Kampala. They produce antiretroviral drugs. Now, ARVs have been proven to reduce the effects of HIV and AIDS and prolong life. Let's find out what inspired the start of this company.
Our turning point came as a country in the late 1980s with the current president of Uganda. Credit be given to him. He made the whole disease, he exposed the disease, the government came in, awareness was brought up, and all of a sudden there was that realization that yes, this was a very big disease. Antiretroviral therapy started becoming a strategy in many countries in the 90s, and Africa was not left behind. My country, Uganda, was one of the very first countries in the world to adopt antiretroviral therapy as a strategy for treatment. Originally, it was basically zidovudine manufactured by GSK, and the cost was that high, and treatment was for a privileged few in society. This was quite appalling. Quite appalling, because if that goes unchecked, it could just get an entire population wiped out. ARVs are not a cure to AIDS, but ARVs are able to boost one's immunity. You are able to reduce the viral load in your blood, and by so doing, reduction of your viral load and increasing your immunity, you are able to live close to a normal life. And that's why it is important to let the population know, especially the young ones, that the future is so big for you young people. The future is so great. A lot awaits you. Don't kill yourself. Preserve yourself. The world needs you.
There you have it, reporters. ARVs can extend the life of someone living with HIV/AIDS for as long as 8 to 12 years, and even more, but there is still no cure to HIV.
You too can stop the spread of HIV and AIDS by getting tested and doing simple things like abstinence, being faithful, and use of condoms.
Stay safe. Cheers.
This van has a fully equipped laboratory, 2 counseling and testing rooms, a reception. It is feared that HIV prevalence in Uganda is rising again. You have the power to stop the spread of HIV and AIDS by getting tested and doing simple things like being abstaining, avoiding peer pressure.
Sorry.
Being abstaining, what does that mean?
I burst out and laughed. Sorry.